Dr. Molina, without a doubt, is a force of nature in terms of striving to make an impact for our community and their experience with cancer. Dr. Molina is receiving an award on behalf of Equal Hope in recognition of all the work that she's done to assure that women with breast cancer have access to care.
I'm a long-term fan of Equal Hope as someone who's collaborated with them across research, practice, and policy, and I'm truly honored by this award. Equal Hope has been a fantastic partner to work with in terms of supporting our efforts to really understand what disparities are in Chicago. What are those driving factors that contribute to disparities at multiple levels? That's included understanding how where somebody goes impacts whether they get a late-stage diagnosis or not. That's including building capacity at those facilities that are under-resourced but are in our backyards on the south and the west sides.
There's a mismatch sometimes about what the needs of a community are and what we think is important. And so we've really sort of pivoted at this point to focus on those communities, get trust in those communities. Those are folks on the ground. They're saying, these are the priorities, these are the needs. Please help us solve these things.
Thinking through how we do community mobilization, how do we work with our community health workers and our advocates and give them access to evidence-based information and maximize their impact and when they reach communities to really navigate them to the highest quality care.
Starting with the community is super important. You go to the patients, you go to those communities and say, what is it that is needed here to help us overcome cancer and the barriers that are associated with cancer and cancer survivorship? This is a unique model. If you look around the United States, you do not see this happening in a lot of places. It's really a ground-up effort.
Equal Hope has been a seminal powerhouse in really shaping equity in the distribution of healthcare and high-quality healthcare to as many folks throughout Chicago as is possible. They've done this through their policy advocacy work, ensuring that everyone has access to accredited facilities, and then capacity building with federally qualified health centers with safety net systems that serve the majority of our neighbors on the south and the west sides.
Equal Hope is a special place. I've met with their leadership to understand kind of what their approach is, and it's very much in line with what we're trying to do at the University of Illinois Cancer Center.
And so through efforts like Equal Hope and partnerships with Equal Hope, we can find collaborative opportunities to assure that everybody has access to this particular type of care. And Dr. Molina is one of those rare individuals whose impact on the communities in Cook County and Chicago have been just phenomenal. So we're really delighted to be partnering with Equal Hope to honor Dr. Molina.
At UIC, our brand is providing the highest quality care and the highest quality research to the widest breadth of people. And it is a mission that I would say is very much shared with Equal Hope. Equal Hope has done a phenomenal job of scaling what we knew in science and transforming that to be what everyone experiences on a daily basis. They continue to be one of my favorite colleagues in the context of always pushing the needle and always thinking about what next.